Hi everybody, my name is Zabine Maradia, and I would like to talk to you about how supporting parents can be the key to reducing or ending child abuse. I want to begin this presentation by reading you a quote from Sophie, who is a victim of child abuse. Specifically, she is a victim of child neglect, whose parents were drug users and often neglected her. She says, "I was often left by myself and I felt so lonely. I even felt lonely when mom and dad were in the house because mentally they were completely out of it." Sophie is a victim of child neglect, and she is not alone. There are many other children who are also victims of child abuse and neglect. To give you an overview of what we will be discussing in this presentation today, I will first give you a background about child abuse and neglect, focusing a little on Arizona. I will then discuss the current solutions that are being implemented in the United States to combat the problem of child abuse and neglect. Finally, I will discuss the solution that my team and I came up with as an effort to reduce rates of child abuse and neglect in a low-income community in Arizona. Child neglect is a very serious problem that current society has not been able to stop. Neglect alone makes up 61% of the nearly 770,000 children who are abused. Neglect can include physical and mental health issues and can increase the risk of aggression and criminal activity in children. In addition to that, children living in a neglectful environment are more likely to show problems in social and emotional development. There are different programs intended to help families, but studies show that once neglect has become a reality for these children, these programs do not show significant or meaningful changes in the family's behavior. So that means that the vicious cycle of child abuse and neglect can continue without help or intervention to improve these children's lives and overall wellness. Nearly a quarter of children who were abused nationally in 2015 were infants who were 1 year of age or younger. Think about the impact of that statement for a moment. 24% of all children who were abused in the United States in 2015 were 12 months of age or younger. These are infants. They solely rely on the parents to have their every single need met, and yet a quarter of these children, of these infants, 1 year of age or younger, were neglected or abused. Child abuse and neglect does not only affect the children and families who are part of the abuse cycle. It's not only limited to them. It goes beyond the individual and household level and leaves an economic impact as well. The economic burden for child maltreatment is large. In 2010 alone, it cost taxpayers $210,012 per average lifetime of a victim of maltreatment. This total includes $32,648 in childhood healthcare costs and nearly $8,000 in special education costs. So let's talk a little bit about the rates of child abuse in Arizona. Here are some statistics about the problem of child abuse and neglect in Arizona. About 3/4 of children abused in Arizona in 2015 were school-aged children, aged 10 years of age or younger. And nearly 28% of those abused children were infants. This is similar to the national rate of infant abuse that we saw in the previous slide. In 2015, the number of children who had been maltreated nationally was approximately 683,500 children, and Arizona alone accounted for nearly 12,000 of the national cases. 12,000. About 93% of these cases were due to neglect. Neglectful parenting behavior is usually seen as an individual issue, but studies show that parenting behaviors, which include neglect, can be influenced by environmental factors as well. Some of the environmental factors are unemployment, poverty in the home and in the community, poor housing conditions, unsafe neighborhoods, and crime rates. Many of these factors contribute to high levels of stress in parents. When parents experience high levels of stress and do not feel supported by their family, friends, or even their communities, they are more likely to abuse their children. The statistics we see here show us that this is a problem that needs a working solution soon. So what are some of the current solutions that are being implemented to reduce rates of child abuse and neglect? We recognize that this is a national problem. We recognize that this is a problem in Arizona. So what is actively being done right now to help get rid of this problem? Home visiting programs are currently being used nationwide and are often the first step Child Protective Services uses to help reduce rates of child abuse or maltreatment and to help at-risk families. Home visiting programs can provide individualized support for families who are at an increased risk of child abuse due to living in low-income neighborhoods, or for families who are already involved in a child abuse and maltreatment case. Home visiting programs are a great step to get these families the individualized care and attention that they need that could stop child abuse or maltreatment from reoccurring or even occurring in the first place within the family. However, research has shown that more intense intervention than just individualized care alone is necessary to actively break the cycle of abuse. Though individualized care is important and is a great step toward reducing abuse and neglect in children, it does not factor in the parental need for social support and social cohesion. Individualized care combined with community support is needed to see a deeper impact than is typically provided in most home visiting programs. Current programs provide individualized care, but they do not focus on community support, which can be helpful to reducing parental stress and increasing perceived social support in parents. Child abuse and neglect prevention programs need to focus on ways to reduce rates of abuse or maltreatment and need to also focus on the contributing risk factors of abuse. Some of these factors include parental stress, mental health, and relationship stress. In a study done that compared national home visiting programs whose overall goal it is to reduce child abuse and neglect, researchers found that a few programs with this goal were not actually effective in reducing rates of child abuse and neglect. Hawaii Healthy Start Program, Healthy Families America, Arizona Child Crisis Centers, and Early Start are all programs aimed toward lowering risk factors associated with child abuse and neglect. But none were actually pivotal in reducing the overall rates of child abuse or neglect, nor were they designed to work with parents with increased levels of stress or mental illness. Results of other studies show that home visiting programs are not designed to address the more complex problems such as high levels of stress or mental health in addition to the problems of abuse or neglect. Studies also show that though home visiting may reduce child abuse and neglect in families who have previously never been involved with child protective services, there is more evidence to show that these programs do not prevent it from reoccurring in families that previously had been involved with Child Protective Services, one or even multiple times. So how can we bridge the gap between community support, individualized care, and reducing overall rates of child abuse and maltreatment in Arizona? We propose the development of a community resource center in the low-income neighborhood of Gisela, Arizona. A low-income neighborhood was chosen because research indicates that there is an association between low-income neighborhoods, poverty, low socioeconomic status, and increased rates of child abuse and neglect. The goal of this community resource center in Gisela, Arizona will be to provide education and support to families who are at risk of child abuse and neglect, or to families who have previously had cases of child abuse or neglect. This community center will help to create social support and neighborhood-based collaboration, while also providing individualized care through parent education and mental health services. Parent and family education have been shown to increase awareness and decrease risk factors for child maltreatment. A community center would facilitate these educational opportunities and networking support systems so that this at-risk community can come together and help one another. This community center will have resources and programs that aim to reduce overall rates of child abuse and neglect. One center will meet most of these high-risk needs through the services that are offered at that center. This center will provide counseling and mental health services to help parents deal with parental and relationship stress. It will also provide parent education classes that can help increase parental sensitivity in an effort to help parents understand and bond with their children better. Finally, there will be on-site childcare so parents can get individualized support and the help that they need while feeling assured that their child is being cared for during their time at the center. Furthermore, this decreases the possibility of parents leaving their children at home while they seek care at the community resource center, thus initiating another case of neglect. And it also reduces the chance that a caregiver who is likely to abuse or maltreat the child will be given charge of that child while the parent is at the community resource center. This community center will be located in the low-income neighborhood of Gisela. This would enable the community to come together and interact, forming social connectedness and support networks for members, and it also meets a gaping need for the low-income community. The center will be a permanent fixture in the neighborhood that will allow families to access it easily in times of stress. Families who feel connected and supported in and by their neighborhood will hopefully feel less stressed, more supported, and will thus be an initiative to help reduce rates of child abuse and maltreatment within the neighborhood and the community. The center would be staffed by volunteers, as well as professional clinicians, social workers, and educators. This project will be paid for by community fundraisers and government subsidization, and the goal is to implement a similar program in other low-income communities across the state of Arizona. So to summarize, child abuse and maltreatment is a huge problem in the United States. Nearly 12,000 children were abused in Arizona alone, with about a quarter of these cases being infants 1 year of age or younger. Home visiting programs are effective in providing individualized care and attention to help reduce rates of child abuse and neglect on a case-by-case and household level. However, Research shows that more intense intervention than individualized care alone is necessary to break the cycle of abuse. This intervention should focus on mental health, parental stress, relationship stress, parent education, and childcare. It should also foster a sense of social support for parents. The Community Resource Center in Gisela, Arizona will help bridge this gap and meet the needs of both social support and individualized care for parents who are at risk of abusing their children, or even for parents who have previously had a child abuse or neglect case with Child Protective Services, one or multiple times. Mental health services, child care, and parent education will be provided to help parents increase parental sensitivity, knowledge of child care, and aim to reduce overall rates of abuse and neglect, while allowing parents to feel more supported and connected within their community and their network. Here are some of the references that my team and I used for the research that is indicated in this presentation. Thank you all so much for your time and attention today. I have posted a couple of questions for your consideration, and I look forward to hearing your responses. Please feel free to ask any questions that you may have. I look forward to engaging in a lively conversation with you all. Thank you for your time.